like a lot of you, I think it's okay to admit that we've all been on an emotional roller coaster for many different reasons recently. And focusing on a little bit of good news, which is the beginning of resuming some normal work of the buck, doesn't in any way take away from dealing with the bad news and the hate and the injustice. But I'm glad that at least for this moment, we're going to focus on some good news, which is that it's day 2 of the recovery of the buck. And I thought it'd be helpful for everyone to hear a little bit about why we have the guidelines that we have to resume something like normal work, even if it's not going to be in a normal way for a while. I want to try to tell you guys about the thought process behind these things, because as Eric said, you know, we're doing the best we can with what we know right now about how to keep ourselves safe at the buck. But we don't know everything, and things are going to change in the coming weeks and months. And we can't tell you how to act in every single circumstance you're going to run into at the buck. So I want to give everyone a bit of a mindset of what are the important principles and what are we trying to accomplish. So the key goal is very simple: to stop transmission, prevent transmission of the SARS-CoV-2 virus at buck. This is very simple. As Eric said, if we have an epidemic outbreak at the buck, it would be catastrophic for our science, and also harmful and bad news for ourselves and for our family members who are exposed, and for the communities in which we live. We don't want the buck to become a cluster that stimulates an exponential outbreak in Marin or contributes to a second wave in the Bay Area. So we want to not have transmission of the virus at buck. And this is unfortunately a really real problem. Odds are that someone in the buck community has had the SARS-CoV-2 virus in the last 2 months. A best guess at the infection rate so far in Marin is probably 1 or 2%, which means that probably a handful of people who work at the buck have had the virus already. And as much as I hate to say it, it's a certainty that many more of us will get the virus in the coming months. A best guess at the overall infection rate prevalence so far in the Bay Area is certainly less than 5%, which means that, you know, my own perspective, unfortunately, is that the worst is almost certainly ahead of us, not behind us. And so we need to do everything we can to prevent that from happening and to do our part to keep ourselves and our community safe. So how do we prevent transmission at the buck? 2 global key principles: try to keep contagious people away from buck, and also try to stop person-to-person transmission at buck. So I'm going to talk through how the various guidelines feed into those 2 key principles. So first, having fewer contagious people at the buck. This seems pretty straightforward, especially the first part. Stay home if you're sick. This is always a good idea. It was a good idea before the COVID outbreak. It's even more of an important good idea now. Stay home if you're sick, so you don't transmit your virus to others. Unfortunately, for SARS-CoV-2, this is not enough. We know that a lot of transmission happens from people who don't know they're sick, don't know they're contagious. This is famous data now from a restaurant where one person who was infected and contagious but had no symptoms when they went out to dinner infected most of the people at their table, along with several other diners and adjacent tables. We know from epidemiological studies that as a best guess, up to half, you guys read in the booklet a number of 44%, but up to half of all transmission happens from people who do not have symptoms at the time they transmit the virus to others. Mostly presymptomatic, meaning they will get symptoms later, they just don't have them yet. But some of it is asymptomatic. There's a small proportion of people who get the virus, who are contagious, but who never develop significant symptoms, as much as 25%. This is more common in younger people and less common in older people. There's essentially no asymptomatic infections in older adults. But asymptomatic, presymptomatic transmission is a real thing and a huge problem. These are data from nursing home residents in Washington showing the viral titers, showing very high viral titers by PCR of live virus that grows in culture up to a week before the first onset of a symptom. So pre-symptomatic infection, contagion, transmission is a huge part of why the SARS-CoV-2 virus is such an enormous problem, along with just the sheer contagiousness of it. And this means that, for example, just staying home if you're sick is not enough, because pre-symptomatic contagious people will still go to work because they don't know any better and will spread the virus to others. So we have to do more. So this is why a second key principle is not just stay home if you're sick, but stay home if you have a higher risk of exposure. And I encourage everyone to think about their exposures, their risk for having gotten the virus and not knowing yet. We need to do the best we can to keep people who are at higher risk of being pre-symptomatic contagious viral carriers from coming to work. So this explains some of the other criteria in the reentry, the daily reentry attestation. So not just that you don't have symptoms of the coronavirus right now, but also that you haven't been exposed to someone with a documented a COVID test, that you don't have a household sick contact. This is also the rationale for reporting all of our travel to HR, so that we can make evidence-based recommendations if you've been to an area that has a higher prevalence, a higher infection risk than the Bay Area, to stay home until it's clear that you're not pre-symptomatic. So core principle number one is trying to limit the number of contagious people at the buck, both by staying home when we're sick and trying to think of our own exposures. And I think in my own mind that when we go to work, and this is true, when we go out with friends or go to family too, we're not just bringing ourselves, but we're bringing the viral exposure of everyone that we've been in close contact with for the last week, along with everyone that they've been in close contact with for the week before that. So you can imagine how this pyramid of exposures that you are carrying in your respiratory tract just grows exponentially as you're in contact with more and more people in your life. And just always be aware that when you go to work, when you see someone, you are bringing this entire exposure history with you. And someone, you may be a pre-symptomatic carrier. Someone that you met a week ago may have been pre-symptomatic and contagious and not known it, because someone that they met a week before that was pre-symptomatic and contagious and didn't know it. So the bottom line is, think about your exposure history. And for example, in different contexts, we can think about this more or less strongly. I'm very conscious of my exposures when I'm working in the hospital, because I really, really don't want to bring the virus into my hospital as a pre-symptomatic carrier. But it's something that we should all think about as we're going to work and interacting more with others. So that informs the core principle of AIM 2, which is to prevent direct transmission of the virus person to person at the buck. If you remember nothing else, just remember, always assume that you are contagious, and assume that everyone else is too. But most importantly, assume that you are, and you don't want to give the virus to anyone else. So we know from these epidemiological studies that most of the transmission of the virus person to person is through exchange of droplets, especially in close contact, especially in indoor spaces. And our reopening plan has 4 kind of key pillars to try to reduce the ability of person-to-person transmission if someone does unknowingly come to work contagious. And these are the face covering policy, the distancing policies, the density policies, and hand washing and surface cleaning policies. So I want to walk through each of those real quickly about why they help. But first to say that we know, and many of you know, that workplace transmission is a huge driver of viral spread. This is also famous data from a call center in South Korea, where an outbreak that started with just 1 or 2 pre-symptomatic individuals spread to half of the people who worked in that space, along with some other folks who worked on the same floor. But the reassuring part of the pattern of this spread is that the highest risk does seem to be relatively close contact, exchanging droplets, and people who are together for some period of time, although that some period of time could be as few as a few minutes. So how do we prevent this? Well, one thing that helps is face coverings, masks, with the idea that if you're wearing a mask, you're less likely to be spraying your droplets into the lungs of someone else. You have to wear masks properly, which means that they have to cover the spaces in your face from which the droplets will spread. So it has to cover your nose, has to cover your mouth, it should go under your chin, and it has to stay that way. I'll talk in a moment about, wearing a mask like this doesn't help anyone, and this is even worse. So make sure your mask is covering those outlets for respiratory droplets. A second thing we can do to reduce the probability, very simply, is distance. And this is just a numbers game. The further apart we are, the less likely that those droplets are going to reach us. 6 feet is it's not a magic number. There's not a brick wall at 6 feet. But most of the droplets that we will expel in normal breathing will only go a few feet, and they'll fall to the ground, not 6 feet. So 6 feet is a good rule of thumb, but just be aware that if you're coughing, if you're sneezing, if you're talking loudly, famously, if you're singing, if you're breathing hard from exercising, those droplets can go further. So 6 feet is not, 6 feet is a good guideline to always be at least 6 feet away from other people, but just be aware that the more distance, the better. The density policies enable this distancing. If we all tried to go to work at the same time, no matter how carefully we planned, it would be impossible to maintain distancing. So we have to reduce the density of people. And there are many different ways to do this. Encouraging people to work from home when they can. Like Eric said, you should only be doing work at the Buck that has to be done at the Buck. Scheduling to stagger shifts, so people working later shifts or earlier shifts, so there's fewer people around. So lowering the density, distancing from each other, and wearing masks all contribute to preventing those droplets from being passed from one person to another. And then finally, but certainly not least, is hand washing and surface cleaning. The data so far say that direct person-to-person droplet transmission is probably a bigger risk than transmitting from surfaces. But still, we want to be careful not to transmit the virus surface to surface, and also to protect ourselves from self-inoculating with these things. So hand washing will help make sure you're not leaving the virus on a surface for someone else to pick up. And it'll make sure that you're not taking the virus from someone else's surface and directly inoculating your face. So hand washing frequently, cleaning commonly used surfaces, and especially being conscious about hand washing when you've touched something that other people have recently touched and that is likely to be contaminated. So first time you walk into a building, first thing you do is wash your hands before you sit down and do anything. Before you put on your mask and after you take off your mask, clean your hands. After you've touched common equipment, after you take gloves off, clean your hands. If you haven't done any of these things for an hour, clean your hands anyway. It doesn't hurt. But be especially thoughtful about hand washing when you've likely just touched something or just touched yourself and are then going to go and touch something else. So none of these methods individually are perfect. They're all just trying to reduce the probability, to make the odds better. But when you do a system of things like this, of imperfect things, systematically and consistently, we know that it works. This is, it's sort of the Swiss cheese model that's common in all sorts of safety methodologies. We're not gonna keep everyone who's contagious away from Buck. We know we can't do that, but we'll keep some of them away. We know that masks aren't perfect and distancing isn't perfect, but we put all these things together and we can really reduce transmission person to person. And we know that these systems work because this is exactly what we are now doing in healthcare settings for the last month or so. Universal masking policies, working from home, only coming when you have to, spreading, in hospital medicine especially, we work as closely knit teams. We're spreading out. We're doing a lot of our interactions by phone again, which we used to do in person. We're washing our hands like crazy, but we're doing all these things. And the net result has been that transmission between healthcare workers at work is pretty uncommon. So for example, at UCSF, about 64 UCSF health employees have contracted the coronavirus. Most of those were acquired in the community, not at work, more than 2/3 of them. Only about 16 of them were acquired at work from patient care. And of course, that's a risk that we don't have to worry about at the Buck. And only 8 were acquired at work from other people. So even in an environment where we have to go to work, we have to work together, many of us can't stay home, and even where there is real coronavirus that we have to take care of these patients, even in that high-risk environment, doing these things systematically radically reduces transmission between people at work. If it works for the hospitals, it'll work for us even better. Of course, so doing these things systematically and consistently is really important, but we are human beings, and I know we're not going to always be perfect, and I'm not always perfect, but I want to really impress on you guys, when you're imperfect, don't be imperfect in catastrophic ways, which is a way of saying that some moments are more important than others for preventing viral transmission. One of the most important things, and I'm saying this because I know how tempting it is that masks are hard to talk through, and they can be hard to breathe through. You just walked up a flight of stairs and you run into someone and you want to say hi and there's something important to talk about. It is really tempting to pull down the mask so you can talk and breathe and be heard. And you're spewing viral droplets directly into their face 2 feet in front of you. Never do that. Never pull down your mask to talk to someone. We'll all need to kind of work out our new ways of new instincts for doing things. Catch your breath. Tell them, oh, I'll talk to you later. I'll give you a call or a Zoom. Go a proper distance from them if you need to pull your mask down and catch your breath. But don't pull your mask down to talk directly to someone. You can follow all these rules 99% of the time, but if you do that, all of your 99% of perfectness is out the window, because if you are contagious, that person will probably get the virus from you. And this is also why we're all being so strict, it seems, about eating together. Because eating together, by definition, not wearing your mask, almost by definition, talking to people in close quarters, is an almost guaranteed way to transmit the virus. And you can remember that figure I showed earlier about the restaurant. If you eat around a table in close contact with a bunch of friends, if one of you is contagious, they will pass it to at least one person, probably most of the group. So again, being good 99% of the time about wearing your mask is completely undone by not being good in the moment when it most matters. So never eat in close quarters. But all of this together, I know we can do this. This is a community effort. This is something where we all have to do our part, because we are protecting ourselves by protecting each other. So we all have to do that together. Like I was just saying with don't be imperfectly catastrophic, seemingly small things, just a few people doing the wrong thing in just the wrong moments can spread the pandemic to dozens of other people. This is how clusters begin. So we all have to do this together. Be consistent, be thoughtful, protect everyone else, and you protect yourself too. And we can do it. I love our Buck community, and I know that we are a community and we do work so well together. So I know that we can do this too. And if there's time to answer questions, I'm sure Eric and certainly I'm happy to answer questions further about this. So go forth, do good science. It's so exciting that we can start some normal work again. And let's just make sure to do it in a way that protects us and protects our community.